Okay. All right, Dr. Chaudhary, stay on with us. We also have some more breaking news coming in. We've learned that Karnataka Chief Minister Siddaramaiah has issued a statement on the HPMV virus, and he has said that in charge of Karnataka Health Department has called for a meeting, and the government will be taking all precautionary measures and document the disease. Let's quickly listen to what he said, then I'll quickly go across to Belly Thomas.
It's found in 2 children. Immediately after seeing this, I talked to Mr. Dinesh Gundu Rao, who is in charge of the health department, and he responded quickly, and he took up a meeting with the department, and whatever decision he takes, the government will implement it, and the government will take all precautionary measures to implement and to prevent the disease.
All right, thank you.
All right, there you heard it. Belly Thomas joins me on the broadcast. Belly, take our viewers through the details. Of course, the first 2 cases detected in India have been in Karnataka. So, assumption is that the Karnataka government is now really taking it very seriously. And Siddaramaiah says that the health department and all the other requisite departments have held all their meetings. What really are we learning so far? What is the government of Karnataka saying?
Devika, the Karnataka Health Minister Dinesh Gundu Rao had called for a meeting of eminent doctors and virologists in the city, along with health officials from the health department, and had an hour-long meeting, and it has come out to say that this particular virus is an existing one, and it is not a new form of virus that had come from any other country to our state. He said that this virus also cannot cause any fatalities, and so there is no need to panic or worry about it. And this was the decision that was taken up during the meeting as to how it could be, this news to be percolated to the other stakeholders in the state. So after conclusion of the meeting, the health minister has come out to state that there is no purpose of there is no need of panicking or worry. There won't be any lockdowns or any hospital admissions that would be required, recalling the COVID times, or this is not a new strain of this particular virus that has come. It is already an existing virus which comes under the umbrella of influenza-like illnesses, and HPMV virus is one among them. And there are also 100 other viruses like that, which certain strains or certain genomes will have fatal effects, and they have kind of concluded that this particular virus strain is not fatal causing.
Belly, stay on with us. We've learned that Karnataka Health Minister Dinesh Gundu Rao has also chaired an emergency meeting after the 2 cases were found in Karnataka. If you can take our viewers through the details, what really has been discussed in this meeting?
Absolutely, Devika. The Karnataka Health Minister Gundu Rao had called in for an emergency meeting with all the doctors, especially virologists, with whom he discussed about the 2 cases in infants of infants that were admitted to a private hospital here, and they were also checking on the reports as to how this virus was diagnosed, and it was concluded in the meeting stating that this particular virus is an existing one which comes under the umbrella of influenza-like illnesses, and it is the vulnerable class of people are infants, the newborns who have lesser immunity, who can contact this virus for which there are medicines and for which there are treatments, and after which they would be discharged. Like in two of the cases that were admitted in Bengaluru's Baptist Hospital, one 3-year-old baby girl, I beg your pardon, 3-month-old baby girl was already discharged home, and the baby boy who has been admitted at present is also in stable condition. Likewise, the probe into those cases by the medical professionals or the hospital doctors also concluded that there was no travel history as such, and so there is no point of contacting a virus that is foreign and new, that's coming into India, Devika.
So I have a soundbite of Dinesh Gundu Rao. Let's quickly listen in.
See, whatever it is, this is not something which is unknown. The HPMV virus is it's a flu virus which is there, and certain percentage of people catch respiratory problems and cold due to this virus. It's was first found out in 2001 in Netherlands. So this is not something that is new. And as far as we know, even the people who, the child also who in Baptist Hospital who had the HPV symptoms, were also very normal. Tomorrow, I think most probably will be discharged. They'll be discharged. So let us see. I mean, we should not press the panic button or create any confusion. And I'm having a meeting now with our officers because I've told them to also have a further discussion with ICMR and Government of India and see anything new is there. And as far as this goes, these are regular kind of symptoms and no fatalities and no serious health. So far, I would say this is not a serious public health issue. See, whatever it is, this is not